Welcome back. We're still talking about the coronavirus pandemic and 1 month of the arrival of the Oxford AstraZeneca vaccine in Nigeria. I have joining me at this time public health consultant Dr. Nseabasi for more on this. Thank you for joining us on TVC News at 7. It's 1 month since about 3.94 million doses of the vaccines arrived, and we understand that over 800,000 Nigerians have been vaccinated. What's your assessment of the exercise?
Thank you very much for having me. 818,000 people across Nigeria have been vaccinated in 1 month. I see this as some progress, but I believe that we should be able to do more than that. We are looking at vaccinating close to 140 million Nigerians between now and the end of 2022. How can we achieve that with the pace that we are going? Mathematically, it's not really feasible. That means there is a need for us to strengthen the strategy that we are using, especially when it has to addressing vaccine hesitancy. As I speak to you now, today I just came back from a primary healthcare center, and I are still having that hesitancy. As a matter of fact, it will shock you to know that some healthcare workers who are supposedly beneficiaries of the first phase of the COVID-19 vaccine rollout have refused blatantly to take the vaccine because they believe that there probably are some side effects that have not been fully explained. Let me say this. I think that at this time, we need to apply 3 principles. 1 is to inform people. 2 is to update people on the information. And 3 is to dispel every misinformation. We know that at some point, there was issues raised by European countries about the safety of AstraZeneca vaccine. Now, the European Medicine Agency cleared the air. But unfortunately, Nigerians who heard about what happened, most of them are not informed about the updates around that. And
all right, Doctor.
A lot of
Doctor, if I may come in here, we're talking about Nigerians in general now. As it is, there's even a state that hasn't received just 1 dose of the vaccine. And, well, they are also Nigerians, but there is an authority in place there which should be able to work in synchronization and collaboration with the national body. What's happening?
Let me put it very clear. The State Primary Healthcare Development Agency is answerable to the State Ministry of Health. And the State Ministry of Health works as a member of the State Executive Cabinet. Now, we have heard in the past few months the reservation of the governor of Kogi State, Yahaya Bello, to this COVID-19 vaccine. And that means to an extent, it is possible, it's most likely that directive from the government house has been that the vaccine should not be used for people in Kogi. Now, I think right here, what we can do, there's no way we can force the state primary healthcare to do what we want. But what we can do is that we can have a discussion with them, particularly in the interest of the tertiary institutions that are within those facilities that are answerable to the federal government. There is need for us to strengthen communication with those states that have refused to receive the vaccine, because if everyone is not protected, if everyone is not safe or immunized, I can assure you that we may be having a lot of issues in the coming months. So there is need for us to discuss further, communicate the risk of not taking this vaccine to these states so that they will see the need to take this vaccine. While not forcing them, which we cannot do that from the federal level, but we can discuss with them and explain what this vaccine, the benefit, the risk-benefit analysis, we can make it and let them understand that the benefit far outweighs whatever risk they anticipate with regards to this vaccine. I think with that, we can get them on board so that they can also take part in this vaccine, so that all Nigerians can be protected from this deadly virus. That is the only way out.
All right, Doctor. And we understand about 70% of the population has to be vaccinated for us to say we are free. And already in some countries, they're talking about a 3rd wave of the pandemic. We hope we don't get there. Thank you very much, public health consultant, Dr. Nseabasi, for joining us on TVC News at 7.
Thank you for having me.